Real news for Americans 50 plus. This is Emeritus News Channel.
Socialized medicine is different from a single payer plan. Now, the way a single payer plan works is that you still have private doctors, private hospitals, providers, etc., but everything is reimbursed through a single payer, usually the government. So Medicare would be an example of a single payer plan. Doctors don't work for Medicare, but Medicare reimburses for services that are provided to seniors who are on Medicare. There have been proposals to have essentially Medicare for all, a single payer plan for all Americans. And that person likes it. So there have, and there are some appealing things to a single payer plan, and there's some countries where that's worked very well. Here's the thing, we're not starting from scratch. We've already got, because of all kinds of historical reasons, we have primarily a employer-based system that uses private insurers alongside a Medicare plan for people above a certain age. And then you've got Medicaid for folks who are very poor and don't have access to health care. So we've got sort of a patchwork system. And it was my belief, and continues to be my belief, that whatever we might do if we were just starting from scratch, that it was important in order to get it done politically, but also to minimize disruptions to families, that we start with what we have, as opposed to try to completely scrap the system and start all over again. And so what my attitude was, if you've got an employer-based system, and a lot of people still get their health insurance through their jobs. Obviously, you're self-employed, so this is a different category, but the majority of people still get their health insurance through their employer. Rather than completely disrupt things for them, my attitude is, let them keep the health insurance that they've got, the doctors that they have. There's still a role for private insurance, but number one, let's have insurance reform so that you can't eliminate people for pre-existing conditions, so that there's none of the cherry picking that's going on to try to just get the healthiest people insured and get rid of the sick people, right? So you've got to set up some rules for how insurance companies operate. Number two, that for people who are self-employed, for small businesses, for others, they should have an option that they can go to if they can't get insurance through the private marketplace. That's why I've said that I think a public option would make sense. What that then does is it gives people a choice. If they're happy with what they've got, if they're employed by somebody who provides them with good health care, you can keep it, you don't have to do anything. But if you don't have health insurance, then you have an option available to you. Now, how this debate is evolving in Washington, unfortunately, sometimes kind of falls into the usual politics, right? So what you've heard is some folks on the other side saying, I'm opposed to a public option because that's going to lead to government running your healthcare system. Now, I don't know how clearly I can say this, but let me try to repeat it. If you've got health insurance that you're happy with through the private sector, then we're not going to force you to do anything. All we're saying is for the 46 million people who don't have health insurance, or for people who've got health insurance like you who are self-employed, but the premiums and the deductibles are so high that you almost never get prevention services. You put off going to a doctor until you're really sick because of the out-of-pocket expenses. Let's change some of those incentives so that we get more people getting prevention, more people getting health care to keep them healthy, as opposed to just treating them when they get sick. And I think that we can come up with a sensible, common sense way that's not disruptive, that still has room for insurance companies in the private sector, but that does not put people in a position where they are potentially bankrupt every time they get sick. Now, how this debate is going to evolve over the next 8 weeks, I'm very open-minded. And if people can show me here's a good idea and here's how we can get it done, and it's not something I've thought of, I'm happy to steal people's ideas. You know, I'm not ideologically driven one way or another about it. So the one thing that I do think is critically important, though, is for self-employed people, because there are a lot of self-employed people here and a lot of small business people. They don't have the ability to pool their health insurance risk. And what that means is part of the reason that typically if you work for a big company, you get a better deal on health insurance than if you're just working for a small company is because there's a bigger pool, and that means that each of us have a certain risk of getting sick, but if that's spread around, everybody's premiums can be lowered because the total risk for everybody is somewhat lower. If you're self-employed, you don't have access to that same pool. And part of what we have to do, and that's where a public plan potentially comes in, or at least some mechanism to allow you to join a big pool, that will help drive down your costs immediately. Your out-of-pocket costs for premiums, lower your deductibles. And what I'd like to see, as I said, is that every plan includes not only prohibitions against discriminating against people with pre-existing conditions, but also every plan should have incentives for people to use preventive services and wellness programs so that they can stay healthier. You're somebody who I think can be directly impacted and directly helped if Congress gets this thing done and gets it on my desk, I hope, by sometime in October of this year. All right? Okay.